Ready to start. Sure, we're all set. Okay, welcome everybody. Welcome back to our second session of the Children's Behavioral Health Policy Academy, Family and Youth Voice Matters. And it's so exciting that we're getting into this second session. And for some of you, it may feel a little repeat that you know your branches of government really well and how we all work together at these different levels. But some of you, it may be new, but it will probably be a great conversation for all of us in the context of life as we know it right now for children's behavioral health. And we're in very hard times, I think, for all of us, and nothing is even following the process sometimes as it should. And we all don't have a lot of control over that. But we're going to do our best today to make sure everybody has a beginning understanding. And for some, it will be a deeper understanding or a review. And I also want to know that, we're going to try to have a family story like we did last week each time, though I do want to recognize that all our families, we never know when we're going to go into crisis or if we can have child support and that. So I had asked Becky Almeida, who's on our board of directors, if she could try to jump in today, but she wasn't sure about childcare and that. So Becky, I don't see your name, but maybe you're not under your name. Are you here? I don't see her so far. And she was concerned whether she could make it. So if Becky does catch up with us, we will definitely have her jump in. I know we have Christine Monroe, who's agreed to share her family story next week, also on our board of directors. And again, the grounding of our family story. I come from this many years involved, but I did get involved in all of this as a family member. So I'm going back to like 1986 is when I first got involved in children's behavioral health. And at that point in time, my son was 9 years old, and he was going in and out of Bradley Hospital. And at that point in time, we didn't have wraparound or system of care. And pretty much life was between acute hospitalization, home with some outpatient, back to acute hospitalization, to outpatient. That really was all I had at that point in time. And then we finally got a system of care grant that came into our state, and I was able to learn about wraparound. And so back then, I was one of the first parents that was working with Carl Dennis and other partners at the national level to introduce wraparound, which we'll talk a little bit more about next week. But I learned that, about home and community-based services, and that we needed to build an array, and that our kids could do better if we had an array of services and supports. And again, I was going outpatient hospitalization, outpatient hospitalization. And then it was great when my son could actually get a worker assigned to us, that he had 20 to 30 hours a week that was taking my son into the community, working on therapeutic levels, working with my family, helping him have social interaction. And then at a point, I had to still turn to the Department of Children, Youth, and Families as the behavioral health lens, because my son really needed to get that extra support that I couldn't afford more intensive services. And we were actually finally able to get him stabilized, and he didn't have to go off to a residential treatment level, but I was real close and I had those paperwork going. But instead, I ended up learning more down the juvenile justice route. And my son ended up becoming more involved in not only having his behavioral health challenges, but he ended up having substance use challenges, gang-related behavior, a lot of challenges down that road. So I also know what it's like to be that parent, and it grounds me in this work and it keeps me going every day. And in addition to only, sharing my family journey, which I had with my son, but I also raised 4 other children. I also come in this as a person in long-term recovery. So when I was young and going through challenges myself, I've always had to work on both my mental health and my own addiction, substance use recovery. And really glad to say I'm many years into that long-term recovery, but it helps ground me in my work. And now we bring that into both my peer recovery perspective and my family perspective. And now I'm a grandparent. I have 2 grandchildren, and being able to talk about that from a grandparent level now. I have a grandson who was diagnosed with Asperger's, and he is now 14 years old and was homeschooled for pretty much most of that time. And now is, as we go into COVID, he is starting school for the first time. So very different flip for me, having been raised my grandchildren at a homeschool level, and also working with a grandson that has Asperger's. So I share some of that because we did not have Becky here today, but I want us to get grounded in that family story and how important it is. I'll ask one more time. Becky, did you come on? And she is not here. So we'll keep checking back in. And again, this will always be sometimes a challenge. I know for us every day, even at our board of directors level, which is always required to be at least 51% families representing children's behavioral health. And I can tell you, even at our board meetings, this is a constant struggle and challenge for us as we go in and out of our own crisis and our need for supports to be fully involved. I'd also like to acknowledge, we have Susan Lindberg here today from Department of Children, Youth and Families. Thank you, Susan, for coming on and your willingness to participate as much as you can. I know you have to come and go a little bit. And Susan is the Associate Director of Community Services and Behavioral Health. I didn't know if you just wanted to say hi a minute to everybody, Susan.
Sure. Hi, I'm very happy to be here. Sorry I missed last week, but I do plan on attending going forward. Yeah, and I work for DCYF, and I oversee the children's behavioral health, actually, the services and residential placements, things like that. But looking forward to this discussion. This is always helpful for us to really hear from the parents and from those who, are living with this day to day.
Thank you so much, Susan. And, I also want to acknowledge last week, I was so excited to also that we had strong representation, both Denise Asian and Tricia Suggs from BHDDH. We also had Deb Golden and a few folks from the Rhode Island Department of Health, Talisa Richardson from Department of Corrections. We had Alice Woods, Ride, and we may even have some other state folks that I just want to thank all of our state partners for participating in this with us as we really identify family and youth voice. I think it's so important, and we need our partners, both local and state level, as we get into the conversations today, especially as, our goal is that this will be a standing family and youth coalition with the ability to have a state action plan. So I think this partnership in the Policy Academy is very helpful and supportive. And any of our state partners want to share anything in welcomes, but before we get started? And with the quietness, I'll just say thank you again. So I'm gonna launch us into this presentation where some of it, like I said, might feel a little bit repetitive, but it's always a good reminder and grounds us. And for some of us, it will be new. Now, I'll actually show my age a little bit as I do this, because in my work of what I've been, brought up in my age, I have, let me just find the right slide here. It is an older presentation, a video I'm going to show you that, depending on your age, you may remember. right alongside me. So let me just make sure I'm getting this up and going here. My one challenge with always making sure we have sound and everything works at once is one of those challenges, right? So I just want to make sure I'm getting the right thing hooked up. The one I need is not showing, so let me try one more time, guys. Here's what we need. Let me just make sure it's showing as the top one. And then I'm gonna go into here and find the video. I think I have it set up correctly. Let me try one time. Are you guys seeing 3 branches of government?
I am.
Okay, good.
Yes.
Great. So
Yep.
let me just make sure. Oh, sorry, guys. Let me just make sure that as I share it, that I have the sound hooked up. So as I share, screen share, branches of government, computer sound, large, and I think we're there. And somebody let me know real quick if we don't have sound.
And last, the 3-ring government.
Gonna have a 3-ring circus someday. People will say it's a fine one, son. Gonna have a 3-ring circus someday. People will come from miles around. Lions, tigers, acrobats and jugglers and clowns galore. Tightrope walkers, pony riders, elephants and so much more. Guess I got the idea right here at school. Felt like a fool when they called my name, talking about the government and how it's arranged, divided in 3 like a circus. Ring 1, executive. 2 is legislative, that's Congress. Ring 3, judiciary. See, it's kinda like my circus. Step right up and visit ring number 1. The show's just begun, meet the president. I am here to see that the laws get done. The ringmaster of the government. On with the show! Hurry, hurry, hurry to ring number 2. See what they do in the Congress. Passing laws and juggling bills. Oh, it's quite a thrill in the Congress. Focus your attention on ring number 3. The judiciary's in the spotlight. The courts take the laws and they tame the crimes, balancing the wrongs with your rights. No one part can be more powerful than any other is. Each controls the other, you see, and that's what we call checks and balance. Says, well, everybody's act is part of the show, and no one's job is more important. The audience is kind of like the country, you know, keeping an eye on their performance. Ring 1, executive. 2 is legislative, that's Congress. Ring 3, judiciary. See, it's kind of like my circus. My circus. I'm gonna have a 3-ring circus someday. People will say it's a fine one, son. But until I get it, I'll do my thing. With government, it's got 3 rings.
That was adorable.
So it brings us back time. And for some of you, that might be new. That's what I was raised around, and I couldn't, in a time of where we are right now, this is, to bring some light with the circus connected to it when it's really serious though right now where we are in life. Also, I hope that when that was developed back when I was a kid, I hope now we would see a lot more diversity in that picture. And they did have some diversity, but we would want to see that a lot more at this time, right? So I just raised that because as I bring back now the PowerPoint, let me see if I can get that back up. Let's see. Here we go. All right. So as we take that from a serious place, right? So they really broke down for us in a very easy way to understand the three branches of government. So when we think of those three branches of government, as they were sharing, we have our executive branch, which would be the president, right? And all the departments and every government agency and such that goes along with that. And if we were to think about that from the Rhode Island level too, we'd have our governor and the governor's branch. So when I recognized all our state agency departments and the folks that were representing them today, they're all part of that executive cabinet and they're brought in under the governor's office. Though I do believe RIDE is separate from that designation, but they work right up at that same level. And thank you, Alice Woods, if you're on, being part of this team with us. And, I think that when we think of this president piece, think of everything we're learning and going about right now and how there was a new judge declared and how there's the power between the courts and whether it's the Supreme, the district court, and how they're interpreting the law and how they can even help that if the presidential challenges arise, the courts got to jump in, right? Or if there's challenges within our state government, the courts need to jump in, right? And then we have our Congress and our legislative branch, which we have both at the federal level, and then we have it within our own state, and we're working and we're creating laws and passing budgets and working directly with them. So again, we have to have a sense of the heart of the three branches of government, and we could talk all day long about how these are coming into play, especially with the election going on and the current world as it is. But today we want to really focus on it at the level of children's behavioral health, whether we're talking at the national federal level or most important, right in our Rhode Island state, and how we're interacting and how the impact and how we interact as families and our children and young adults across these three branches. And how do we begin to understand how we move children's behavioral health and partner across these three branches of government. Also important in this process, and we could take this from a federal level right down to a state and local level too, is within the budget execution, right? And so we know so many programs and services that fall within children's behavioral health or we need in connection to it, go through a budget process, right? And some of that budgeting is happening at a local level, especially as we think of local school districts and stuff, right up to a state budget level, to some of us even depending on different federal funds that are coming down to make that happen. So in Rhode Island, we have a budgetary process where we go through this through what we call a fiscal year that starts going through July right through June, and then we start the process all over again. And in Rhode Island, we do that every year. A state like Connecticut, they have a different model. They do a budget execution every 2 years. So each state can be a little bit different and may operate a little differently. But what is important to understand in this process is usually from June to October, there's a lot of budget preparation going on. So different state agencies are being asked to really look at the data, where things are, what the budget, what they can afford, how that relates even back to federal program budget connections. And they have to do their best review and put forward some preparation that actually goes up to the governor's level. That starts to get reviewed, and there's division and discussion back and forth between that work. And then usually what we'll see is between November, January, the governor's really combing over it, making some decisions. And usually around the beginning of January, we see that budget released by the governor. And then the legislative process starts to really review that budget and go forward. And here they say like January to March, but many times it can, especially in Rhode Island, even go right up to that June date, or based on the current status of everything we're going through with COVID, we may not even be there yet. So we are now like in a catch where we should be starting to work on our next budget, but we're still working on approving our current budget. So it's important that we begin to think of children's behavioral health in aspect to this. Now, I can remember many years of advocacy at the State House, and in the early years of my advocacy, we had a better budget. And I could know that I was organizing a group of families and youth, and we were going to the State House to educate, and we were, asking more for like $30 million and had a good chance of getting it, to where now we're more in a climate, in a context of losing $30 million. So this is a very hard time, and we need to begin to understand and read and interpret the budgets so that we can help make change within that area. And not only does that take place through across the, this executive and congressional branch as we look at it, we then have the other responsibility that happens and connects through the legislative and government branch around how we look at our legislation and how bills become laws. So I'm going to show us one more short video clip. Let's see if I get this right. I missed this.
You sure got to climb a lot of steps to get.
I missed one step, guys. You probably can't hear that. So let me just go back in one more time.
Oh, we can hear it.
Oh, you can. All right. Awesome. Thank you, Kyle. All right.
At this Capitol building here in Washington. Well, I wonder who that sad little scrap of paper is.
I'm just a bill. Yes, I'm only a bill. And I'm sitting here on Capitol Hill. Well, it's a long, long journey to the capital city. It's a long, long wait while I'm sitting in committee. But I know I'll be a law someday. At least I hope and pray that I will. But today I am still just a bill.
Gee, Bill, you certainly have a lot of patience and courage.
Well, I got this far. When I started, I wasn't even a bill. I was just an idea. Some folks back home decided they wanted a law passed, so they called their local congressman, and he said, "You're right, there ought to be a law." Then he sat down and wrote me out and introduced me to Congress, and I became a bill. And I'll remain a bill until they decide to make me a law. I'm just a bill. Yes, I'm only a bill. And
The video isn't going.
Oh, that's what I was afraid of. That's
Yeah, we
exactly
had the audio, but the video was frozen on the first frame.
Okay. Sorry about that.
I saw that on an electric company.
Okay, that's what I was afraid of, that I had missed a step. Sorry about that, everyone. This is where we're all still learning technical, right? So let's see. Let me try this one more time. share screen. Let me know if anything's not right.
Woo, you sure gotta climb a lot of steps to get to this Capitol building here in Washington. Well, I wonder who that sad little scrap of paper is.
I'm just a bill. Yes, I'm only a bill. And I'm sitting here on Capitol Hill. Well, it's a long, long journey to the capital city. It's a long, long wait while I'm sitting in committee. But I know I'll be a law someday. At least I hope and pray that I will. But today I am still just a bill.
Gee, Bill, you certainly have a lot of patience and courage.
Well, I got this far. When I started, I wasn't even a bill. I was just an idea. Some folks back home decided they wanted a law passed, so they called their local congressman, and he said, "You're right, there ought to be a law." Then he sat down and wrote me out and introduced me to Congress, and I became a bill. And I'll remain a bill until they decide to make me a law. I'm just a bill. Yes, I'm only a bill. And I got as far as Capitol Hill. Well, now I'm stuck in committee, and I'll sit here and wait while a few key congressmen discuss and debate whether they should let me be a law. I hope and pray that they will. But today I am still just a bill.
Listen to those congressmen arguing. Is all that discussion and debate about you?
Yeah, I'm one of the lucky ones. Most bills never even get this far. I hope they decide to report on me favorably, otherwise I may die.
Die?
Yeah, die in committee. Oh, but it looks like I'm going to live. Now I go to the House of Representatives and they vote on me.
If they vote yes, what happens?
Then I go to the Senate and the whole thing starts all over again.
Oh, no.
Oh, yes. I'm just a bill. Yes, I'm only a bill. And if they vote for me on Capitol Hill, well, then I'm off to the White House where I'll wait in a line with a lot of other bills for the president to sign. And if he signs me, then I'll be a law. I hope and pray that he will. But today I am still just a bill.
You mean even if the whole Congress says you should be a law, the president can still say no?
Yes, that's called a veto. If the president vetoes me, I have to go back to Congress and they vote on me again, and by that time you're so
By
old.
that time, it's very unlikely that you become a law. It's not easy to become a law, is it?
No, but how I hope and pray that I will. But today I am still just a bill.
He signed your bill. Now you're a law.
Oh, yes.
Great. So I think I did that without losing it. So let me go back and, oh. Sorry, guys. Sorry about that. So, okay, let me get back to you. Wonderful. Okay. I'll share my screen one more time back to the presentation. So we heard about how a bill becomes a law, right? And this was actually put out by the, Rhode Island government. So we have this idea, right, that the bill becomes a law. And we put that together in those ideas. I can think of one that was one of the most important ones I worked on, and that was the voluntary custody law. And I can remember that at that point in time when I was working on that with Rhode Island, many of us had children that were going up into the residential level and trying to get the help and support we needed for children's behavioral health of our child. And what happened is we had parents that were paying large amount of money, even having to go bankrupt, losing their homes. And even worse than that was having to be felt like charged with neglect and abuse in order to get the behavioral health services you needed for your child. And so we worked with a lot of state partners, legal advocates, And of course, we had to find a sponsor of the bill, and we had to get those sponsors to agree with us. You know, and that's sort of an old piece that I remember doing that work. And it was my first time actually being part of a process. And now we do have a voluntary custody act in Rhode Island. Unfortunately, at the federal level, we do still not have a voluntary custody act. And we still have families across the country who have to go through giving up custody of their children in order to get the behavioral health services that they need. You know, we've been working with the Fatherhood Initiative that we work on in Rhode Island, and we're working on a bill that would put forward. So now we're trying to find, you know, those local senators or representatives that can really sponsor us. And so that bill gets introduced because we have that support from one of the chambers, whether it's the House or the Senate. And then that goes and it gets assigned to a committee, and the committee works together. And then hopefully we can get both chambers, both the House and the Senate, to approve the bill. And then it begins to go and it gets analyzed and it gets voted back and forth. And then hopefully, you know, we can approve it and it can go up to the governor's desk and become approved. But sometimes it gets sent back down. Sometimes we're not all in agreement. Sometimes it needs changes. Even within our own work group, we can be going through all those things. But we are working towards getting that law that we really need. And so when we talk about children's behavioral health, I can also remember out of some of the systemic care work that we did, we actually were able to pass a law around an infrastructure called CASP, and which created local councils and family voice and all that. But even if you pass a law like that, it's not going to do well unless somebody can totally keep pushing it, put it to regulation, keep revisiting it, moving it forward, right? And then sometimes it can, you know, go through a process of dying, like shared in the video, and then we have to start all over again. So again, we could spend a whole, 2 hours on how a bill becomes a law, but it's, again, a very important part of our branch of government. And again, how is it impacting children every day with behavioral health needs? So part of what we want to do is we want to be able to have us break down into groups with our staff taking the lead again to help facilitate and bring back a report. And I'd ask you in your groups just to make sure everybody gets to meet each other, discuss how each branch of government can have an impact on children's behavioral health, what might be the strengths and challenges taking place within those branches as it relates to children's behavioral health. And then especially because of the time we're in, how does COVID or the challenges we're facing around racial discrimination or even the election itself add to the challenges taking place without losing the sense of children's behavioral health? And then what strategies could we do for really promoting policy and practice change within those three branches of government? So I'm going to ask and take the time now to break down into the groups. And if our facilitators can help our groups through that discussion and process, then we'll come back and share as a large group. So let me do the next step of getting us in breakout rooms. And part of what I will be doing is just moving a few folks around just so I know all our facilitators are each in a different room. Let's see this. Check, so we got. So I think we're all set, and I'm gonna send off everybody to their rooms, and I will check in and make sure that everybody's getting off to a great start.
Anybody there? I need to be in with
Hi, Denise.
Oh, jeez. Oh.
On.
Able to like hopefully do some of that.
David, you're always eating. What you eating?
Welcome back, everyone. I was jumping around and heard some really good discussion. Helped a few people get lost. Sorry, Cameron. I'm glad to have everybody back and
No worries.
It's about have everyone.
I still have that Congress song in my head.
There you go. So with our discussions, if we could do our report outs, Danielle, you want to go first?
Let's just say it. Please don't call on me first. All right. Yeah, I'll go first.
Okay.
So some of our answers for the first two questions really kind of blended together. Some of our personal experiences, as well as the challenges and opportunities for change that we saw within the three branches it was a lot. Lori was talking about how, money was being distributed in the wrong places. And I think that flowed kind of into Nadine's perspective that we're not as proactive, that we have to wait until all, we have to prove that there's a need. So we have to wait until the statistics get really bad. We have to wait until people are homeless and don't have any other opportunities before we can present something and say, hey, we need help with housing. So I think maybe changing policies around that to make it a little bit easier to get preventative or proactive services. Some of things that I've worked on as far as legislation was working with sex trafficking victims, particularly youth, is my experience as I was exploited by an older man while I was a child. It wasn't illegal to do that back then. So there was nothing that could be done. So when I got older, I helped change those legislation. We created some policies and trained other providers on what to do and how to engage CSEC victims or youth who were being exploited. We were able to implement protocols and guidelines for that. Kathy had mentioned how the Affordable Care Act and the Mental Health Parity Act was very helpful for her and how that was a positive within the system. We also mentioned, there's a lack of fluency between the branches, and even within each separate branch, there's a lack of fluency. So that's an opportunity for change there. Nadine, when we got to, unfortunately, there was so much good stuff to talk about. We didn't really get to finish all the questions, but we did get down to how COVID, racial discrimination, and the current election affects people's mental health now, and it just affects everything. And so one thing that Nadine brought up that I think was a great point was we don't realize our privilege of personal space. People who are living in confined, condensed areas, in apartment complexes, in public housing, public transportation, all these places, they're more prone to catching the coronavirus. So that was one way that those disparities were highlighted within COVID. So that's kind of where we ended because we had so much to talk about, but that's where we left off.
Thank you so much, Danielle. And how about Kyle? Kyle, are you willing to go next?
Sure. We had a good discussion. Similarly, we did not get through all of the 5 points. We discussed the different aspects of the executive branch, how the various agencies that are under the control of the governor, how they're affecting children's behavioral health. And with that, we got into a little bit of the crossover of funding. For example, how money that's going towards education, a portion of that could be towards children's mental health through the school system, targeting them there with maybe so it's like not like it's a Department of Health aspect of that, but how the money from the budget can be in different areas, and we can still kind of help children's mental health through the different parts. Sorry. In the judicial aspect, we're talking about how not only is there sort of an individual portion where a judge may be making a decision on an individual's future, but also that they act as the oversight for the various agencies if there's an injustice, as well as if, for example, a medical insurance or any area where there could be an injustice, that they're where we go to for the oversight and to help uphold the laws. And then with the legislative aspect, they are where the laws start, and helping, and they can have an assistance in more flexibility, where sometimes these the programs that are offered, there's a slight difference between neighborhood or Tufts or Blue Cross, and there are overlaps, but it's still, there's an opportunity there to provide more flexibility, even going across state lines for medical insurance, medical coverage, or treatment. And also there are sort of where the decisions may be made. The big aspect was telehealth that we kind of came up with, how that creates, it's a therapist or social worker or somebody, anyone who's trying to help, and that can certainly from home and just sort of being on the computer all the time. About some areas of
You're cutting out a little bit, Kyle. I don't know if one of
children about the transition out. Just the last part I was going to say was transitioning from being a child to adult, so like around the, when children transition, having a mental health throughout their lives, and then transitioning to being able to take care of themselves in a responsible, healthy way.
Great. Thank you, Kyle. And I know you cut out a little bit here or there. Is there anybody else from the team that wanted to add anything that that might have cut out on Kyle, or you wanted to add?
Kyle, I think you did a great job.
Thank you, Kate. Thank you. Excellent. And it was only just a little bit we lost Kyle, not much at all. So, and if we could have Naomi go next.
Yeah, we talked, it was a really good, people gave a lot of really good points. I could just piggyback kind of like continue in regards to like the insurance fees and like Medicaid in regards to insurance and what supports and how long those supports are in place, and kind of a system change in regards to and around policies around how much support a child could have in regards to like different insurances provide only like 2 weeks, like Blue Cross only provides 2 weeks sometimes for support around mental health, and it really has, every insurance has different regulations. So really being consistent even in that when it comes to our children with behavioral health. More a big push for more community-based services and keeping our kids out of institutions. So because there's not enough community supports, and really looking into like the system of care and like, you know, really ending, a lot of our kids are ending up in hospitalizations. But then there's not enough beds either. So, and the supports are a short period of time as well. So we should, they also shared in regards to having more clinicians that with different times where like, because a lot of our clinicians have 8 to 5. So being more flexible in regards to what the supports that we give our children, you know, because there are families that are going to have a crisis in the middle of the night. So, you know, really being flexible with families and providing those supports at all hours of the day. What else? In regards to like our special needs and behavioral health population, there's really a lack of resources around like transition and just providing those supports and education. There's really none. There's a little bit more support for those that have, you know, special education and IEP, and even then it's very vague around like, you know, social emotional support. There's a goal around social emotional support, but really there's a lack of that wraparound. And so more of that wraparound support. And we also talked about confidentiality and how like having more of a shared plan of care, but how can we be able to do that without breaking that confidentiality, where we could still share our child's information without breaking that. So what will that look like, and how can we continue to collaborate without breaking that? And also I had put here more trauma-informed practices and policies, really advocating for that. And really looking into other models. I know that I shared about Project Aware. Project Aware has a grant with SAMHSA around children's mental health. And they have a pilot in Woonsocket, Providence, and Pawtucket. And they really are doing a lot of the things that we're talking about, that wraparound support, you know, collaborating with other agencies, you know, having that, you know, they have Providence Center. I know like Providence Center within the schools. They're educating not only the teachers on mental health and bringing in like DCYF and FCCP to share information, the teachers, but they're also going into the community health clinics and providing them education around mental health. So kind of using what's working, what we're doing at a local level, and kind of using that model to see how we could support statewide, but also looking at what other states are doing as well around this, so that we can kind of use some of those things within our own state. If I'm missing anything, please jump in and share. I know that we talked a lot about different things, really good stuff.
Mental health and substance abuse resources programs for teenagers.
Yes.
And we also,
yep.
Sorry, I was gonna say, we also talked about paying community health workers, mentors, peer support people a much higher wage, because we talked about the fact that they might not be clinicians. What they do, the work that they do is therapy. It's therapeutic, and they should be compensated more. David was sharing, sometimes they're, you know, they put themselves at risk to be there with the young people, and he can certainly talk more, but.
Yeah, there's a lot of staff who've gotten punched, beat up, bitten, you know, you name it, and have to how would you say, have to put hold a kid, and you have to use the proper I forgot what they call it, but yeah,
Restraining.
restraining, yeah, because they got to
So
go
even
through
policies around restraining,
yeah, like
and using
they
more
have to follow
restorative
the ones,
practices.
yeah, they got to follow the one from Cornell or something like that. And yeah, I mean, I seen a worker, her hair get pulled, ponytail get pulled right out of her head by a kid, a teenage kid that was going through crisis, and and the pay what they were going, it was crazy. But yeah,
And I
it
could
was a
I
good
could
point there.
definitely share in regards to that, that using more of those restorative practices and training staff around restorative practice, really looking at that system of care, how we're supporting them within the schools, within the communities, those that are in the system and in groups home, and looking at what are the practices that are being used. I've worked in residential for a very long time, but also I've done home based, and I've been a behavioral specialist within the schools as well. And I've seen the differences even in restraining, how those policies and practices really changed from 10 years ago on how, and it's still an issue now in regards to restraints and how we're supporting children with behavioral health, where now we're using more of that restorative practices, when a child is manifesting any behaviors, really looking at the child, at the individual, and not the behavior, and really having those moments of conversation. And so that it's important to really that those screenings and early interventions and ongoing services are so important, so that we really don't let these kids fall through the cracks, and really use good practices that are really going to support them, because that's the problem. We've used really excessive force sometimes with these kids, and practices that haven't worked, where we continue to see issues continue.
Great. And if I could pull you back, thank you so much, Naomi. And we're going to get into the deeper detail of the service array even next week. So we're going to take this even a deeper level than everything you are sharing, which I think is right on point. And if we could switch over now to Melissa.
Just unmuting myself. It always takes me a little bit longer than most. I don't know why. So we had a really, really great discussion, and we talked about a lot of the same stuff that was kind of discussed in the groups before us. And I thought it was interesting listening to Kyle report out about oversight. Angela brought that up in our group as well. We talked about what that oversight looks like, and making sure that our group knew that there's an oversight, that there's a committee that looks over this and make sure that people aren't being mistreated and the laws aren't being broken. So I thought that was interesting that both of our groups talked about that. We also discussed, what does the decision-making process look like when you're a child transitioning to a youth? So if you're 18 and you're in mental health services, when do those services become yours? When do you get ownership of those? Because when you're 17, your mom, your dad, your other guardians have that ownership. So what would it look like to have a more consistent plan? And when do children get to make that decision? And what does that look like on a legislative level? About what the age of consent is. So I thought that was super interesting to think about, because I know for myself, when I was 18, my mom made the decisions about my mental health for me. And I'm curious about what would that have looked like if I had had the ability to make some of those decisions for myself. So I thought that was something really interesting to think about, and had never thought about it before. We also talked a little bit about, how do we make these services fair to everybody? What would the legislation look like if it said services are fair for everybody? But what does that even mean? If you're coming over from another country and you understand mental health to look like this, and you understand the process to look like this, and then you come over here and we don't even have the same definition of what anything is. And then you're expected to navigate the system. You're given a list of stuff to do, but the system is so different than what you're used to. How do you meet in the middle? What's the fair playing ground so that services are fair and equitable for all people? And that was also a very interesting conversation that we had. And families just having a lack of information, a lack of knowledge about what services are even out there. I know for me, I'm going to age myself, nobody talked about mental health. Nobody talked about depression. Depression, it was like, suck it up, you're sad, move on. And now children talk about this all the time, but who's helping lead that conversation with children? Like, we're leaving them out to talk about it themselves? Oh my goodness, like, where does school step in? Where does legislation mandate what we teach our children, and what responsibilities of the school and what responsibility of our families? So we had a lot of really interesting conversations around that. So thank you for letting me share. I hope I did okay with our group. If I missed anything, feel free to chime in.
Thank you so much, Melissa. And Renee.
So Lisa, I'm not gonna lie, man, our group, I mean, I had an amazing group. However, we talked more about how to get even these bills in front of somebody. That's what's lacking. Like, all this information is solid and there's so much information, but how do we present it to actually be heard, to be listened? And, you know, that's the problem right now, is people aren't being heard. And so, you know, a lot of us had a good feedback as far as, you know, like Talissa was saying, you know, getting people that had, that were present in past policies that were, you know, supported, like getting past supporters on policies that have been put through, and getting their support, getting their sponsorship, or if they're no longer involved in that process, guiding us to the right people, so we could get that solid foundation of support from our local representatives and from community organizations, and that powerful foundation to present it in a fashion where it's going to be heard, whether, you know, maybe not that day, but eventually, you know, we're planting the seeds for it to be heard on a higher level. We talked about, like, I kind of went on, like, in a personal, like with Ashley, she's home with 3 kids right now, virtual learning. And I wanted to hear a real person and her struggles right now, you know, and it just shows that not only our children are suffering, like, with their mental and behavioral health, but as adults, as moms, as parents, you know, we're also struggling too. And, you know, I really feel like we need that support on that level, because, like, we know if we're not okay, our children are 100% okay, because they feed off of the way that we are too. So if we're lacking somewhere with our mental health, our kids feel that tension, they feel that. So of course their mental health will be, you know, disturbed as well. We also spoke about, you know, getting more like online. Social media is huge right now, getting more information online, starting our own petitions on certain things, because, like, change.org, for example, you get a petition out there, you get a certain amount of signatures signed. By law, it has to get sent to, you know, to the White House. Like, I've seen some crazy laws, like bills being sent, and these are, if we get, you know, so more online, like petitions, more community advocacy online, like in PSN, man, we do a great job advertising online, social media. I see Tides, I see Rifin, I see so many things. It just, you know, keep getting out there with social media and just getting the right people involved. I mean, as a child who spent her life in residential, you know, there's so many things I could say. I could write a book about my story, you know, and eventually maybe one day I will. But definitely, you know, having more focus on how we can prevent things from happening instead of allowing, like you know, Melissa was saying, and Kyle, and piggybacking off of Naomi and Danielle, how can we prevent it to where they'll listen to us before it gets out of hand? How can we stand up and share and be heard before somebody commits suicide, or before somebody overdoses, or before somebody relapses, or before somebody goes back into residential treatment? How can we come together as a whole and prevent it from happening, for them to listen? So yeah, I mean, sorry, I'm just going on, but you know, I'm very passionate, as you know, Lisa, about this, because I've experienced it firsthand, and more definitely needs to get done. And I think we have a really good group of people here, you know, on this Policy Academy, and we're going to make a change. And I'm speaking that into the universe right now. Changes will be made.
Thank you so much, Renee. Thank you. And I think, you know, the way that you sort of summarized and brought us to the one or two pieces that didn't get said by everybody, how do we, you know, what I heard you say almost leads us right into our next speaker presentation. And that is, you know, how do we get our voices heard? How do we organize? How do we make sure that we're getting to the right levels and the right decision makers so that we can really make change? So I'm excited. I know Marty has just signed on with us, Marty Rosenberg. So excited to have her here. And I've worked with Marty over a number of years. Marty and I go way back to when Right Care was first starting, and I was a participant on the Right Care Advisory Board. And Marty was organizing back then and trying to get us all going in the right direction towards advocacy. And Right Care ended up being one of the best programs in the country. Marty, you know, she's done a lot of work, and even back to when Health Source Rhode Island was coming in, she worked under the Providence Plan to get that outreach up and going, even worked at the national level under US Action around the healthcare work. Her last role before coming into where she is now was under the state innovation model and leading a lot of the work around the SIMS grant. And, you know, she's a professor at Brown University who teaches around all this change work. And recently she is now the director of policy planning and research at our Executive Office of Health and Human Services. But most important, Marty is a true advocate, and I'm so admired getting the opportunity to work with her over all the years. So Marty, welcome. And can I turn it over to introduce you and have us start to think about how we organize?
Thank you, Lisa. It's great to be here. You know, it's a Friday afternoon. It's been an insane week. I was off the end of last week and the beginning of this week doing things around that thing that's happening nationally. So you know, are we all just looking at our phones and our computers and trying to see what's happening? So I'm glad to be here. So I have my state hat on, but I am never far away from my training and my history as a community organizer and as a person who is completely committed to making sure that, you know, the voices of folks from the community are heard wherever they need to be heard. And I used to do that from outside of government. Now my role in great part is to listen to voices outside of government and try to bring them inside of government. So I've done, you know, you've seen me in a lot of sort of stakeholder engagement moments. I think what I'd really like to do is answer your questions because I know that you've been talking for a while and I might have some insights and be able to answer some questions. But before I do that, I think it could be useful to do just a couple of things, just a couple of the community organizing basics that just might help you in thinking through you know, how you're going to be thinking about what you're doing. And I take this from the work of an organization called Midwest Academy. It's the organizing group that I was trained in. They have a book called Organizing for Social Change. And if you, there's often, you know, used copies around, or pick up one, you know, you can order it a bunch of different places. But if you were to take one community organizing book, I would suggest that one, just because I have worked in it and think that the way that it encourages people to think about power makes a lot of sense. So when I do I do these workshops, so I start out with a question to you all, and let me ask you, why do people organize? Why do you think people organize for social change? Just, I would take yourself off mute and have at it. We'll
Because it works better as a team.
Yeah, absolutely. Why else?
Because they're deeply unhappy with something that's going on.
Mm-hmm. Good. Somebody said to leverage
Similar,
power. Good. Kyle.
similar interest in something that they want changed.
Mm-hmm. Great. Why else? Why do people organize? Jessica.
Because they're not seeing results in an area that they want change.
Yep. And Renee says power in numbers. Yep.
And because they can't sleep at night if they're not advocating.
Mm-hmm. Very good.
I think it's important to organize because when people become uncomfortable with something, you know, the idea is to change it, but you're going to fight against a system that's already organized and been in place for decades. So you have to be organized and you have to be strategic when organizing change.
Great. We are social beings, mutual support, have their voices heard. These are stuff in the chat. Keep going. Why do people organize? All right, let me ask you a different question. Why don't they organize? Why don't people organize?
Fear.
Mm-hmm.
Yeah, fear.
Yeah. Why else?
Apathy.
Mm-hmm.
Well, you know, in terms of, you know, because if you've gone from this question, from the first question to this question, if we affect change, and then you need that group, and then the group becomes a community, and a strong community has a lot of power.
Mm-hmm. Mm-hmm.
Just to piggyback on fear, I think you risk losing a lot more than, you know, what you may be gaining potentially.
You know
some
what?
groups of people don't feel like they've been just put to the side for so long that they don't feel like they have a voice.
Mm-hmm. Yes. Let's not use the chat. I want to hear your voices. Say out some of the stuff that you have said.
I think stigma.
Intimidation.
Stigma for sure. Society has kind of, you know, put a you know, to be seen not heard label on a lot of people, and that's what we, based on our own traumas in our own life, you know, the stigma behind it, that can really cause people not to want to, you know, they don't, or lack of education too on a certain subject. They may want to spread their voice and be heard, but they're not educated properly on the matter.
Mm-hmm.
I think
they want change, but they want change, but they're not willing to sacrifice.
Could be, or maybe they're not in a place to sacrifice.
Yeah, I mentioned like it doesn't really pay well. Most, you know, community organizing, a lot of people do it for free and volunteer time, which means that you have to have the ability to do that, to sacrifice your time and your effort into something that does not put food on your table. And there's a sense of isolation, I think, that you might recognize something that's an issue for you, but you don't always know where your community is, and your community might not be in your neighborhood. So how do you get a cohort of people who are gonna like mobilize with you to do something if you don't know where they are or if anybody else is experiencing what you're experiencing?
True. Very true. Melissa had noted they don't know where to start. It's very good. Denise had noted they don't know how. There's another thing. It goes both ways to why people do and why people don't. Any other, before we move on, any other final thoughts to one more thing?
Feelings of intimidation.
True.
I was gonna say money as well, in regards to like organizing the materials that you need,
right,
and having the funds to do so.
Right, resources. And thinking about what you are embarking on right now, this work group and this committee and your plans to make change and what you will need to do as organizers. People don't organize often because nobody asks them to. And thus they do organize. Why?
Because they're asked to step up and join in something bigger, better.
Exactly, because somebody asks them, and that's what you're going to be, as I understand from Lisa. Lisa has asked you, and then you're going to be the organizers who ask other people. So you are going to be able to facilitate all of the good things that we've just talked about. And now that we've identified the reasons that people don't do it, you're going to want to have those in your mind. And I see that this is recording, so good. You can go back and take all of the notes and figure out what the blocks are, what the challenges are for people, their fear, their, I think about emotions a lot when I think about organizing, their desire for empowerment. So, deal with the negative emotions, work through them, and seek the positive emotions. I'm going to, if I can, share my screen because I have Lisa, can you let me do that? Oops, sorry. It's still disabled. I don't need to, but.
Yeah, I'm just trying to find you. We got a long list here. Let me see. And if anybody can help me, if you can see it. There, I see it. I see you now. Here we go. You should be all set now, Marty.
So this is the PowerPoint that I have used. So we just did that. I'm going to talk you through the three principles of community organizing, tell you a couple stories, and then ask for your questions. So part of the Midwest Academy, hey, Casey, stop it. It's my dog. She's very excited about community organizing. So we talk about winning real victories for real people. What do you think that means? What does that sound like to you? Winning real victories for real people.
Something tangible. The outcome is it's measurable.
Absolutely. Good. What else?
Creating change for people who need the change the most.
Mm-hmm. Yep. So I talk, I'll joke if I'm doing a presentation, we could make a statue of Lisa, and we could advocate, go to the State House and say, there should be a statue of Lisa Conlin in front of the State House. She's done so much great work for kids and families in Rhode Island, and we should recognize her with a statue. However, Lisa would be probably thrilled, a little embarrassed probably, but thrilled about having a statue in front of the State House. And it would be very nice for you all to go and support her and her family to come, but it would not put food on anybody's table or a roof over anybody's head or a place for any child who desperately needs a better place to be. And so that's not what we're about. We're about real victories for folks who are our constituency, who are us, and not like putting a statue of somebody up.
The resources are limited, so you have to use them accordingly.
Absolutely. Why would you waste your time advocating for something that is not a real victory for real people who are involved? And so there are criteria when we think about the issues that you want to organize around. There are a set of criteria that I can show you and that you would read about in that book. And this is one of them. How real is this victory? And is it for the people that we who are our folks. The second principle of community organizing is giving people a sense of their own power, which we also talk about never doing anything for people that they can do for themselves. So I lobbied at the State House along with Lisa for 20 years. And after a time, they knew I was coming. What do you, and so I'll get to what that meant, but what do you think, giving people a sense of their own power, what does that mean? Why do we have that as a principle?
Because it's important to me. If I have the power and it's something that's important to me, I'm gonna fight stronger. I'm gonna be able to be more powerful in my own story.
Good.
I also think that people can advocate for others, but nothing has the same significance unless it comes from the person who's experiencing it.
Yes.
And I think if this is about organizing, the people have probably already suffered some form of injustice, which usually involves some other entity taking power away from them. And so we, with our good intentions, will come in and do things for them and be their voice. And now we're just replicating that same dynamic of you are voiceless and I am the one that has power over you, but I'm nice.
That's very wise. Very wise.
I think too, this is Tara Ripon. I think also, supporting people and mentoring them through the stages and really like taking them and bringing them up to the State House and letting them talk to their representatives, talk to people. That gives people, I know when I first started doing it, it was like, wow, like my representative knows me by first name. Like I'm at the, in DC and I'm able to talk to my legislators. Like that gives you a sense of empowerment. And then it reinvigorates your passion to keep moving and keep, bringing more people into, to be leaders in that and have their own voice.
Absolutely. So when I said that I lobbied for 20 years, I don't know, year 12, 13, 14, it's a lot of years, right? They saw me, they said, oh, it's Marty Rosenberg. I know exactly what she's going to talk to me about. But if I had with me somebody who experienced the thing that we were fighting for, whether it was to expand right care, including to children who were undocumented, or to have interpreter services in hospitals, or to create the Office of the Health Insurance Commissioner because people were getting cheated on their health insurance. They could argue with me, but they couldn't argue with somebody, as you well know, that is experiencing the thing that we were advocating around. So that's the importance of it. I had one legislator over the 20 years be obnoxious to a constituent type person. One out of 20 years. Otherwise, they were respectful. They were kind of obnoxious to me over time. It didn't matter. I didn't care. We just helped unelect them later. But having people who are their constituents is critically important. The last one, permanently alter the relations of power. Anybody have a sense of what that means? It's a little more complicated, not as clear. Not as obvious.
I think that if your organizing is successful, then the same people shouldn't still have the same power at the beginning of the process than at the end.
Yes, perfect. I do it. This is the hand motion for permanently altering. I'll tell a story that can be long, but I'm trying to make it really short. It was in the 90s. It was a long time ago. Columbia HCA, which was a awful, terrible, international, very powerful hospital corporation, wanted to buy Roger Williams Hospital. They came, we did a lot of research. We figured out that they reused needles and medical supply. They treated their nurses horribly. Their quality was low, but people saw the ability to make a buck. And so they wanted Roger Williams to be bought by this company. We had a huge campaign. We were totally overpowered at the beginning. We held a press conference to kick it off, no press. By the end, thanks to Patrick Kennedy, who used to be a congressman, being involved, and the FBI, pictures of the FBI and the nightly news showing up at Columbia HCA's headquarters and taking out, documents because they were clearly breaking the law. We won that campaign. That was not we, at that moment, we, this ragtag group of organizers, as we called ourselves, had more power than the largest hospital corporation in the world. That's not permanently altering the relations of power. In some years after that, Lifespan and Care New England, you know them, right? The big hospital corporation in state, the systems, they wanted to merge. They're still trying to merge, but they wanted to merge in the 90s. And they came to me and they called me up and they said, Marty, we want to merge and we want to come talk to you. Why is that permanently altering the relations of power? Why did they call me?
Because you had a huge impact on the outcome of the first decision for the hospital that wanted to buy up Roger Williams. So you had influence in and power in the decision from that first outcome.
And I think they also knew that you knew how to bring together, you know, people around the issue and could provide them with good feedback, both positive and negative, about, you know, how things would be, you know, how experiences would be changed.
You built your reputation.
And let me be clear, it was a huge coalition. It was not me. They happened to call me, but it was, I want to be really clear, it was a coalition and huge and large and organized and such. Any other thoughts on permanently altering relations?
They became a stakeholder or became recognized as a stakeholder.
What was their emotion?
You wanted to get their way.
Mm-hmm.
Probably fear of community accountability.
It was, yeah. So, you know, I like to take more time to play this out, but we don't have a lot of time here. So yeah, they were scared that we were going to do to them what we had done to Columbia HCA and kick them out. It turns out, ironically, we never took a position because we had people in our coalition on both sides of that, but it is ironic that they're still trying to merge. So I'm going to do one more slide. And this is the 3 ways. Sometimes we call them like the 3 additional principles, but this is really 3 ways to alter the relations of power. Build lasting organizations. PSN has been around for a really long time. You have a lasting organization people know and respect. This is a trick question. How were they able to call me? How was Lifespan, were Lifespan and Care New England able to call me?
You've made yourself easily accessible.
Yes, but how? This is a trick question. This is not, don't think strategic. It's a truly trick question.
You then went to work for an organization where your name was publicly listed.
Ocean State Action was literally listed in the phone book at the time. It was before, this was a long time ago. It was before there were websites, but yes, we had a listing in the phone book and they knew how to get to us. That's the value of lasting organizations. We had a coalition with a name, but they called me because they knew that I worked for the organization. They could just reach me. So when we think about making change, we want to win victories in the most lasting way possible. Pieces of legislation, laws, bills, before they become law, they're called bills. Ordinances at the city level, written regulations. We never want to make change with a handshake, right? Because it just goes away. And you need to hold elected officials, and I will add to this, state administration officials accountable to what they say they're going to do. You need to hold them accountable, and which is what you were just talking about. So, you know, if we had more time, I would go through, and you were in one of my workshops, I would go through the different components of power, and we would talk about the criteria of choosing an issue. Show you here. So the first criteria for choosing the issues that you want to work on are the 3 things we just talked about. But then you want to think about, you know, is it winnable? Can you win it? Is it widely felt? Lots of people support it. Is it deeply felt? They support it a lot. Is it understandable? Is it, you have a clear target, the person who can give you what you want? So I'm going to stop now and then go to your questions. But if you check out Organizing for Social Change, you'll see all of this. I stole it directly from them and have trained on it now for almost more than 30 years. So it's good stuff, and I hope that it's helpful to you. And now I would love to answer any questions that you have from your day of work, and if I can be helpful at all.
Anybody have a question for Marty? And Marty will definitely find the material so that we can share that with everyone.
Cool.
Anybody have a question for Marty?
Marty, I don't really have a question. I probably have a lot of questions. They just haven't come up yet. But seriously, I want to be like you when I grow up. Like, I really do. Like, you empower me. And we look a lot like each other, if you can't tell. Look at this. Glasses, like I'm like a mini Marty. I love it. And truly, thank you. Thank you for everything that you do on a daily basis. And you do it from the heart. You do it from for the right reasons. We need definitely more people like you to advocate and to be on our side, you know? So if we could clone you, which maybe one day I'll be like you when I grow up.
You know, I love doing these trainings and I love teaching because, you know, it's just, it is just giving you the strategic ways to think about what you're doing. I mean, you all are me. It's where I started in rooms like this, and well, it was a real room, but discussions like this, trying to figure out how to make change, how to take what you know better than anybody else. You know this, you know the policy. You may not have some of the words that other people use, but you know what the policy should be. And you just need to learn how to get them to the decision makers in the most effective way possible. But you start with a level of knowledge that most people don't have about the issues that you care about.
Right. I think that's so key that you're sharing that, Marty, because we don't realize that we probably are the most knowledgeable,
yeah,
you know, for our own direct experience. And for all my years that I went to the State House and educated folks in that, there was nothing more powerful than testimony of people that had the direct experience. Now, we needed to partner with, like, we have our state and local partners here with us in the training because they have the data, they have the outcomes of the bigger picture, but it's the data matched with the story, you know. And I think that would be one final question I would ask, if nobody else has a question, is the importance of how to share your story. What do they look for in that story?
So I usually ask the question, do you want to use stories or numbers? What do you think the answer is?
Stories.
Both.
Both, absolutely. Because you know what? People learn and retain things differently. You know, you're doing adult learning right here, and you know, some people are visual, some people are oral. Yeah, and I do a thing about, like, a little message thing about, you know, I could talk to you about health insurance and how, you know, when we were doing the best with the Affordable Care Act, we were down to about 4% uninsured and blah, blah, blah. And I could do all the numbers. And some people really like link onto that. They can totally get it. And then I could say, you know, at the height of our insurance, you know, we had about 4% uninsurance. So if you had 10 neighbors, that means that 4 of them, you know, would have been uninsured. But now with COVID, it's grown to whatever. And that means that your 5th and your 6th neighbor. And so, you find different ways to tell the stories that are going to get to the people that you want to convince.
Thank you. Anybody? Go right ahead, Naomi.
And in regards to, like, I love data and numbers, especially when you're gonna see like a huge numbers in regards to, like, I know that I'm part of like a trauma-informed campaign, and in regards to like the supports, how, you know, if you get more trauma-informed supports in this area, you're gonna see a 50% decrease in mental health with children. So like even that number there, there are like drastically, it's like when you say it to someone, they're gonna be like a 50%. Like that 4% may be different, but for other things, it may be very big and will probably make a bigger impact. So I really like being able to share those numbers, because you can really see how drastic the change will be if you get more trauma-informed supports within our community, etc. So I really do like the data.
Yep. Excellent. Danielle, do you want to make your point? It's such a good point.
So as I mentioned, I was involved with some steep topics. I was involved with sex trafficking, and I did a lot of work around that. And a lot of that included telling my story. And this is where we got all the funding, we got all the support that we needed, but you know, we had to deal with, and I say we as in other survivors who have had to tell their story to gain this funding. If we leave that room feeling exploited again, feeling vulnerable, feeling hurt, triggered, while everybody else is so happy because they received payment. So I think it's essential to empower people who are using their lived experience to compensate them and demonstrate that you actually value them, because I was dragged around as, that was my title, was the survivor. And it was like so degrading, because then people would look at me like, you know, so it's essential. And as far as telling your story, I think it's essential. I've had lots of practice. I've had to tell the most personal, vulnerable, and scary parts of my life to some of the most insensitive people at the State House, you know? And I think it's essential to focus on the key points and focus on your objective and give as little detail as possible, and focus on your objective, focus on what you're trying to get across, what you're trying to be teaching with, and remember that it's not all about you, that it's about what you're advocating for. So those were just a couple things that I wanted to add or say.
Absolutely. That's such a good point. Thank you so much.
Well, thank you so much, Marty. This is great. And I know, as you know, the Academy is just to get us going, and our goal is to be a coalition. So we'd love to reach back out to you and just get support with our organizing. And I think we're on our way.
Always happy to. And I can, let me see, the version of the deck that I pulled up was something I did for a class, but I can happily send you what I did. You know, I'll put the, you know, take out the stuff that doesn't fit.
That would be great.
It's, there's some exercises in there that won't make a lot of sense in the deck, but get the book and you can read all about it.
Definitely. Thank you so much, Marty. We'll talk to you soon. Thank you.
Great to be here.
Yeah, and thank you,
Bye.
everybody. I know we're at our time, so we'll be coming back together next week. And next week we are definitely gonna go even deeper into the service array and how we begin to strategize our priority needs around that. So I look forward to seeing everybody next week, and thank you so much.
Thank you.
Thank you.
Thank you.
Thanks, everybody.
Bye,
Have a
everybody.
good weekend. See you next week.
Take care.
For everyone.